Hi, I'm Dr. Kurt Woeller for Autism Recovery System and Sunrise Functional Medicine Center. One of the things that I'm commonly asked when it comes to medications, such as antibiotics or antifungals for individuals with autism who are dealing with a bacterial problem or a yeast candida problem, is which of these two is most appropriate to use. So it's important to break down these into individual categories. An antibiotic is a prescription medication that is specific for bacterial infections. Now, that could be a bacterial infection in the sinus, in the lungs, or the digestive system. So an example of an antibiotic would be penicillin, or another common one that's commonly used in individuals who have digestive problems related to bacteria, or let's say a parasite, is something called metronidazole or Flagyl. So those are antibiotics. Those will not treat an underlying candida or digestive yeast problem. In fact, many antibiotics, because they're often overused and because they will decrease good bacteria in the digestive system, can actually lead to a candida or yeast overgrowth situation. An antifungal is a prescription medication that is for a candida or a yeast problem. So fungus, which is this large biological group, yeast, it actually falls within the biological group called fungi. Candida is an example of a yeast. So an antifungal medication is sometimes called an anti-yeast or an anti-candida medication. Some examples would be nystatin, fluconazole, also something called diflucan, or itraconazole, also called Sporanox. Now, certain antifungal medications, like Sporanox, for example, can also be used for mold overgrowth issues or mold exposure problems, because mold is also a fungi. Although it's, mold is not a yeast, it falls under the biological group called fungi. So an antifungal medication like nystatin or diflucan is not going to be effective for bacteria. So they're effective for yeast or candida problems, but they're not effective for bacterial problems. So you need to separate out the two. So an antibiotic is for bacteria, an antifungal is for a candida, yeast, and sometimes mold problem. Okay? Thanks so much. I'm Dr. Kurt Woeller for Autism Recovery System. Thank you.